More now on our top story, and emergency service workers in England are to be allowed to avoid quarantine under new rules that are aimed at minimising the disruption that's been caused by the so-called pingdemic. The British Medical Association says that the problem is not the excessive pinging of the NHS COVID app, but rather that the government's coronavirus strategy has caused rocketing case numbers. Well, joining me now is Dr Kailash Chand, Honorary Vice President of the BMA. Dr Chand, good afternoon to you. I think any conversation about the pingdemic, as it's being called, really needs to be framed as to where we are in the course of this pandemic. And what would you say about the current rate of increase in the number of cases? Are you seeing a bend yet?
I think let's just remember one thing. Pandemic is there because of pandemic. So don't forget that. And blaming ping is just like blaming a fire alarm when fire goes off. We all know the cases are surging, hospital admissions are surging. And one thing which is more worrying is that quite a few people who are being admitted have double vaccination. So this is a real concern. In this situation, exempting healthcare staff from self-isolation to get back to work, in my view, is a desperate situation or position. For us, for BMA, the most important thing is the safety of its staff and patients.
Yes, I quite understand, which is why I want to understand from you really where you think we are in this wave. I mean, we've seen the surge of cases, as you say, but is the rate of increase starting to slow?
You see, I think we are, as I'm saying, pretty bad. I think it's almost serious. I look into the hospital situation. Admissions have gone through the roof, more or less, and we are concerned. Particularly now, people are even coming for non-COVID diseases. So you don't want those patients to come and get infected because we don't have a foolproof system in which just saying that the people who are now being exempted from this are totally free from infection. That's my real worry is, and we don't want to infect staff from staff. And Samantha, remember, in this pandemic for last 16 months, the social care and the healthcare worker, we have lost more than 1,500. And we can't afford to lose more, in my view, by following these untested policies. I think what we got to do now is to have a real pilots to see whether this particular policy by Department of Health and Boris Johnson is safe for the patients, safe for the staff.
Yeah, nobody is diminishing the impact on the staff who are working to fight this disease. Much has been made of the weakened link between infection and hospitalisations since the vaccine programme. You're talking there about the number of people double vaxxed in hospital. Crucially, how does our ratio compare to other countries that have got similar numbers of people vaccinated? I've been hearing that actually we're doing worse and more people who are vaccinated are ending up in hospital. Is that true?
Samantha, I also don't have specific data as far as the comparison with the other countries is concerned. But as far as I know, that we are one of the worst when comparing to the developed world. And let's not talk about the developing world. In developed world also, our situation is very worse. That's more the reason that we got to be more cautious. We got to really look into it, how we safeguard the staff and the patients. We already, Samantha, we are about 100,000 short of NHS workers. We are 112,000 short of social care worker. So in a way, I think it's a dire situation. We got to really look into it much more introspected. In that sense, we all, you and me, all want to open it up. But what we are saying and what I'm saying is, let's open up in a safer environment. What exactly is, I'm not saying that now lifting those lockdown is a wrong thing, but you should have done with measures like social distancing or mask wearing, particularly in closed spaces, is still paramount and still very important. I think the Department of Health and Boris Johnson got to look back into the policy and reconsider it, that how the hospitals can work efficiently.
What is your view of calls to move more quickly to a scenario whereby people who have had double vaccinations, instead of isolating, are able to take lateral flow tests? What is the public health implication of that?
I think, you see, there's a lot of work is being done on that. And we understand by 16th of August, there's a possibility that we will have the results of these pilots with us and will be able to perhaps reassure either way, whether that's the right thing or not. So today, the public health message still got to be of cautious.
All right, Dr. Chand, good to get your thoughts on Sky News. Thank you.